Breaking a bone or injuring a joint can set you back from your daily activities, but the way doctors repair and treat their patients continues to change. Dr. Christie Heikes from Twin Cities Orthopedics joins us now to talk about some of the advancements in her field today. Dr. Heikes, thanks for being here.
Thanks for having me.
And it is remarkable. We were talking before we came back live on the air here that it is amazing. You hear about ACL injuries a lot with professional athletes, but you say you're seeing things like that a lot more commonly with the so-called weekend warriors, or you have another name for it.
Yeah, we have, it happens in the athletes, and those are the high-profile cases. We also see it in the parents of our high school athletes and even in the, post-retiree age, and that has been a term we call the geezer jock generation.
I'm getting very close to that, so I can relate to this. But you have people who are staying active a lot longer. They're running 10Ks and half marathons and marathons. They're biking a lot. And with all of these activities come injuries. Some of them from wear and tear, some from maybe a traumatic injury of some kind.
Yeah, we see the whole gamut. We're seeing a range from the traumatic, tip over of the bicycle to the people are just staying active a lot longer. And so the overuse over time, that's what happens.
And now let's talk specifically about ACL injuries. We hear about them a lot with NFL running backs, but these happen to everyday folks as well. Let's take a look at some video. You say that new surgical techniques can make ACL surgery much less invasive and therefore a quicker recovery time. Show us what we're looking at here.
Yeah, with newer technologies, we're able to get the same work done through smaller incisions. The smaller incisions allow less traumatic handling of the soft tissues, which leads to less swelling. The less swelling our patients have, the quicker, well, first of all, the less pain they have post-operatively, which they're really happy about. And then they're able to start their rehab sooner, and they can progress a little faster.
And in many cases, I presume they can resume the activities they were doing before.
Yes, that's our goal. Our goal is to take our patients, and they usually come in and they were a basketball player, a soccer player, runner, and they want to get back to those same activities. That's what we really try to do, and get them back to be their best again. Out on the courses, out on the, golfing, tennis, whatever it is.
And that, of course, is one of the goals of Twin Cities Orthopedics. That's where Dr. Heikes is from. Let's take a look at a graphic, give you some idea of what Twin Cities Orthopedics provides. You've got all kinds of same-day surgery, MRI scans, physical therapy, because we know, again, these weekend warriors need a lot of that. So, again, Dr. Christie Heikes from Twin Cities Orthopedics. And I know many of you out there, after this newscast, will be out running or doing whatever. And hopefully you won't end up with an injury. But if you do, Twin Cities Orthopedics is there to help. Dr. Heikes, thanks for being here. I appreciate it.
Thanks.
And we'll be back in just a moment. Stay tuned.